What happens to a man's body when he keeps masturbating after 60? Did you know that over 58% of men over 60 still masturbate regularly, but only a fraction talk about it openly? Before we jump in, hit that like button if you're curious about what really happens to your body after 60. Subscribe, share this with a friend who's not afraid to talk about real health topics, and drop a comment below with your experience or thoughts about today's subject. We read every single one. The silent question. Every man over 60 asks, and why it matters more than you think. Reaching the milestone of 60 years, or even cruising well past it, often brings a mix of pride, reflection, and for many men, a quiet but persistent question about their sexual health and habits. Masturbation, once casually dismissed as the pastime of teenagers or young adults, suddenly feels wrapped in layers of doubt and taboo. Is it still normal for a man my age? Is it even healthy? Could it be harmful? Or conversely, could it actually be beneficial? These questions don't just emerge out of nowhere. They are the echoes of decades of social silence, cultural stigma, and a lack of open conversation around male sexuality as we age. Many men suffer in silence because society has painted masturbation as something shameful or irrelevant once you're past your prime. But recent expert opinions and scientific studies are challenging these outdated views. For instance, Dr. David Ley, a clinical psychologist specializing in sexual health, argues that masturbation remains a vital part of healthy sexual function throughout a man's life. It's not merely a physical release, it's a complex mind-body interaction that can influence mood, stress levels, and even cardiovascular health. In fact, regular masturbation can promote better sleep, reduce anxiety, and maintain pelvic floor muscle tone, factors that are especially critical for men as they age. Real-life experiences echo these findings. Take John, 68, who shared in a men's health forum that continuing to masturbate helped him stay connected to his sexuality and confidence, even after his partner passed away. He described it as a form of self-care, not just a physical act, but a ritual that helped him navigate loneliness and maintain emotional balance. This is far from an isolated case. Many aging men find that masturbation helps preserve sexual function, improves prostate health by encouraging regular ejaculation, and supports overall well-being. However, it's not without risks or considerations. Medical experts caution that excessive or compulsive masturbation could be a sign of underlying issues such as anxiety or depression. Moreover, for men with certain health conditions like prostate inflammation or erectile dysfunction, how and when they masturbate might require more thoughtful management. This is why understanding the nuances, the how, the why, and the when is just as important as the act itself. In this video, we're not just skimming over surface-level ideas or repeating common myths. We're going deep into the latest research, psychological insights, and real stories from men just like you. We'll explore the physical benefits and potential pitfalls, address the emotional and mental health angles, and provide practical advice on how to approach masturbation as a healthy part of aging. Whether you're curious, cautious, or confused, by the end of this, you'll have a clearer, science-backed perspective that might just transform how you view your private moments in your golden years. So stick with us, because what you're about to learn isn't just about sex. It's about health, happiness, and reclaiming a vital part of your life that deserves respect, regardless of your age. Take a second to like this video if you value transparency around men's health. Share this with a friend who needs to hear this, and don't forget to subscribe so you don't miss our upcoming episodes. The biological and psychological value of masturbation. After 60, let's begin with the body. At its core, masturbation is a biological function, like eating or sleeping. When a man ejaculates, he isn't just releasing semen, he's also increasing blood circulation to the pelvic region, flexing his pelvic floor muscles, stimulating neurological activity, releasing feel-good hormones like dopamine, oxytocin, and prolactin. Personal take, as a man in my 60s myself, I've found that this practice keeps me more in tune with my body. I don't see it as solo sex, but as a form of sexual self-care. Scientific backing, a landmark study published in the journal European Urology, found that men who ejaculated 21 or more times a month had a significantly lower risk of prostate cancer. Why? Because regular ejaculation clears out potentially harmful carcinogens from the prostate. The 10 benefits of masturbation for men over 60. Let's break it down. 1. Maintains penile health. Just like any other muscle, the penis requires exercise. Erections oxygenate the penile tissues and help preserve elasticity. 2. Prostate protection. Frequent ejaculation can reduce the accumulation of fluid in the prostate gland, reducing risk factors for inflammation and cancer. 3. Pelvic floor. Strengthening. Orgasms involve involuntary contractions that work the same muscles used to control urination and support the bladder. 4. Stress reduction. Orgasm leads to a noticeable drop in cortisol. For seniors juggling health concerns and emotional stress, this matters. 5. Mood enhancement. Masturbation activates the reward system in your brain. The oxytocin and dopamine released during climax boost emotional well-being. 6. Better sleep. Post-orgasm, prolactin levels spike. This hormone has a sedative effect that promotes restful sleep. 7. Sexual desire retention. Use it or lose it applies here. Regular stimulation keeps your sexual neural pathways active. 8. Ejaculatory control. Masturbation can be a tool to combat premature ejaculation through techniques like the start-stop method. 9. Self-examination. Regular contact with your genitals helps detect abnormalities like lumps or pain early. 10. Improve circulation. Stimulating the pelvic area helps ensure blood flows effectively to the lower organs. Real-life example. One of our subscribers, John from Arizona, told us that after incorporating regular masturbation and Kegel exercises, he regained control over mild urinary incontinence. But what are the risks? Let's be real. Anything done in excess or without intention can become harmful. Here are the 10 risks. 1. Social withdrawal. If masturbation replaces real intimacy, it can lead to isolation, especially among widowers. 2. Skin damage. Aggressive technique can cause micro tears. Use lube and go slow. 3. Desensitization. The same stimulation over and over might make partnered sex less satisfying. 4th. Masking ED. Relying on solo sex may hide underlying erectile dysfunction that needs medical attention. 5. Postural damage. Masturbating in a hunched position can compress pelvic nerves. Try lying down. 6. Emotional escape. If you're using it to avoid feelings of loneliness, that's a red flag. 7. Guilt and shame. Cultural and religious conditioning can create inner conflict. Speak with a sex-positive therapist if needed. 8. Pelvic congestion. Frequent ejaculation may cause aching in the groin. Take breaks. 9. Reduced sperm quality. Not a concern unless you're trying to conceive, but worth noting. 10. Porn dependency. Relying on extreme porn for stimulation can distort real-world expectations. Timeline. What happens over time? If you continue, week 1 to 2, enhanced mood, decreased stress, slight improvements in sleep. Month 1, noticeable improvement in urinary control, increased morning erections, boost in confidence. Month 3, better emotional regulation, healthier libido levels, improved sexual stamina. Month 6 to 12, reduced prostate inflammation, as reported by some urologists, strengthened pelvic floor, more awareness and acceptance of one's own body and needs. Conclusion, is masturbation still healthy after 60? Absolutely, but with mindfulness? The answer is yes, with caveats. Masturbation after 60 can be a powerful act of physical and emotional self-care. It promotes everything from prostate health to mental clarity. But like any tool, it must be used with awareness and balance. Here's the summary. It strengthens your pelvic muscles and preserves erectile function. It improves your sleep, mood, and stress levels. It helps monitor changes in your body and prevent disease. But overdoing it or doing it to avoid emotional pain can lead to problems. Personal reflection. At this age, I see it not as an indulgence, but as hygiene. It's not just about climax, it's about connection, awareness, and care. This video is for educational purposes only. If you have specific concerns, consult a healthcare provider. If you found this valuable, please like the video, subscribe to our channel, and hit that bell icon. Drop your comments. Your story could empower another man out there. Stay healthy, stay informed, stay unapologetically curious.